As members of Catholic Healthcare, we strive to do the very best for our brothers and sisters in developing countries, yet our best intentions are not always fulfilled.
Medical recovery is something that can either be extraordinarily helpful and encouraging to people who have almost nothing, or it can be, as some people have labeled it, junk for Jesus.
It is estimated that Catholic healthcare organizations in the United States dispose of 600,000 tons of medical surplus annually. Some of these materials are deposited into landfills, and even those that are donated often go to waste because the appropriate steps have not been taken to ensure they can be properly utilized.
I've been in settings where the hospitals receive big shipments of donations from overseas. Many times that is accompanied by a big ceremony. Ministry of Health is present and they're so proud that they received this big donation from overseas. When you actually get to looking at the contents of the shipment, you realize there's a lot of stuff that is pretty much not useful for that setting. They didn't request it, they don't need it, they don't use it. Because they don't want to embarrass anybody, that stuff is usually kept in storage until somebody has the nerve to dispose of it or make it go away.
When I was in Haiti a few months after the earthquake, there was one room near the operating room where I could see some really pretty new and modern equipment that had been sent down there, covered in dust. But it had been sent down without the right parts, without the right directions for using it, and without any attempt to do preventive maintenance, education. And so you had wonderful, expensive, beautiful equipment that couldn't be used. It was the most graphic example that we absolutely have to do it right, or we are not serving our brothers and sisters.
CHA has conducted surveys and research to help our health ministries ensure that we are all doing it right. And with input from Catholic Relief Services, the World Health Organization, and the Partnership for Quality Medical Donations, we have developed standards or best practices that will help Catholic ministries assess the capacity and operations of their MSRO partners. 9 key areas have been identified that can be boiled down to the need for MSROs to exhibit excellence in organization, relationships, and operations if they are to properly redistribute the right resources to the right people. Under the umbrella of organization, impassioned and motivated leaders are essential to bring the vision to fruition.
This person has to be one of the greatest salespersons known to man in order to, first of all, get it started, sell the idea, and then continue to develop the idea and to pull in things like quality, respect, the global marketplace.
It's also important that we have key employees that are in staffed positions and that they utilize volunteers effectively.
The research also shows that relationships are absolutely essential.
Before you contract someone to act on your behalf and donate your materials, you have to be sure this organization has the right relationships. They must have outreach at multiple levels, have clear channels for receiving and requesting input and guidance from the recipient, and be willing to report both positive and negative impact on donations.
We need to show respect for their operation. We need to show respect for their intelligence and what they've learned about working in their environment.
The operations of the medical surplus recovery organizations should be led by the beneficiary's request, connecting the donors with the solicitor's need, sending only the items requested, and ensuring that the donation is appropriate and effective.
I think the MSROs have a duty to make sure there's practices and systems in place to ensure the integrity of the devices being shipped to the developing world. And that includes proper storage, proper transportation, proper packaging, proper labeling, so that the beneficiaries receive quality items.
We work very closely with our solicitors to make sure they get exactly what they need. They go to our online inventory, they order. Our logistical staff talk with them on the phone. We've recently begun Skyping, showing them the items, making sure this is exactly what you're talking about, because sometimes there are different cultural names for some of the same items.
Ensuring that they have sorting processes that sort things down to like items so that the recipient or solicitor can order the items that they need for the procedures that they do is an important aspect of having a well-run MSRO.
They need to be able to go to their shelf and pull off from the shelf what they need to treat the person in front of them. They don't have time to sort and struggle. We are doing that on our end.
Expiration is also important. As we talk about expiration, many people would say that it's expired, but it's still good. We and the WHO believe that there should be no double standard.
We have to be just as diligent and just as careful and just as conscientious about the materials that we use in caring for those people in remote countries as we are about the materials that we have in our own surgical suites, in our own patient rooms.
One might assume that all MSROs already abide by these standards of excellence. Unfortunately, they do not. Catholic healthcare organizations must evaluate the effectiveness of their medical recovery partners and ensure that their donations are going to good use.
Unfortunately, at times we have not been diligent about this, but we can and will do better. I don't think we thought enough about it. It wasn't deliberate, but we didn't think enough about what happens if we send materials overseas that are broken or that need parts that can't be found over there or that need service from persons who are not trained to give service to those machines or equipment.
Material managers, executive leadership, trustees, and sponsors can and should champion best practices in medical surplus. We are already doing good work. We can provide even greater assistance by ensuring our donations are being made appropriately on our behalf.
I think in essence, it's really a matter of justice. God has provided us with the skills and the minds that we need to realize marvelous advances in medicine. And I really think those advances belong to all His people. It's essential not only for the people we serve and their health, but it's really essential for a just society.